I will call the November 17th personnel bargaining meeting to order. I certify that opening meeting laws have been met with proper posting. We have a 15-item agenda. I'd look for adoption.
Motion to approve.
Second.
Motion made and seconded. All in favor, say aye.
Aye.
Opposed? Motion carried. Has everyone had a chance to read through the meeting minutes from the last two meetings, the 20th of October and the emergency one on the 10th of November?
What was the date the email came out with our, I can't find it on here, and then I've already opened it. I sent it out on Monday. Okay, thank you. Yep, that was the 14th.
Any corrections or additions to the meeting minutes from the previous two meetings?
Here it is.
I'll move for approval.
Okay. Motion by Austin to approve. Second by Fritsch. All in favor, say aye.
Aye.
All opposed? Motion carried. And next, we will move on to performance review policy update for discussion, possible action.
So this committee previously tasked the HR department to work with department heads to propose a comprehensive performance review policy or procedure. All department heads were invited to participate and contribute their thoughts to this process, as well as a handful of non-leadership employees. We wanted employee opinions on this as well. Because the existing policy has not been updated since 2010, there are a substantial amount of proposed updates. For that reason, I'm going to just read the policy as we have drafted it, and then I can certainly answer any questions this committee may have afterwards. So the introduction, we did not change. The purpose of this policy is to define performance review practices for Trempealeau County. The scope is still the same. This policy applies to regular full-time and regular part-time employees. It does exclude elected officials. The overall purpose of performance evaluations is to keep employees apprised of their performance, to assist supervisory personnel in apprising employees of their strengths, progress, and/or areas that need improvement, and to periodically record essential information about an employee's work performance. The performance review frequency section has been entirely updated, so I have clearly identified what was taken out, and the green areas is what has been added. A review of employees' performance will be conducted annually. Annual performance evaluations shall be conducted within the first quarter of each calendar year, so January 1st through March 31st. This gives a 3-month window for department heads and leadership to effectively evaluate their staff. Employees within their 1-year introductory period shall receive at minimum 1 performance evaluation at approximately 6 months of employment and/or entry into a new position due to promotion, demotion, and/or transfer. This is to align with the introductory period language that is already in the existing handbook. It is encouraged but is not a requirement for supervisors to complete a performance evaluation near the end of an employee's introductory period to determine if the employee has successfully completed their introductory period. Employees may request feedback on their performance at any time, but a formal performance review will only be completed as described per this policy. Procedural guidelines. The HR department is responsible for the overall administration of employee performance review program and will provide a systematic procedure to ensure that a viable performance review program is ongoing. It is the responsibility of the department head to ensure that the performance of each employee under their direction is reviewed and recorded in accordance with this policy and the prescribed procedure. The department head will coordinate with the appropriate personnel to conduct the performance review process and ensure timely completion and return of documents to the HR department upon completion. Each performance evaluation will be reviewed and signed by the employee's immediate supervisor and department head when applicable, prior to any discussion with the affected employee. If there is a disagreement as to the performance rating at any category or in any category, the matter will be resolved prior to the presentation of the signed form to the employee. So the department head and the supervisor or sergeant must agree before the employee is brought in. The supervisor will hold a separate conference with each employee. The employee will read the evaluation form and note the rating in each category. The employee is encouraged to discuss any rating and comment on the form with the supervisor at this time. The original of all completed materials will be sent to the HR department for filing within 5 working days from the date of the review conference. Comments by the employee must be read at each supervisory level before the evaluation form is forwarded to the HR department for filing. Guidelines for performance review conference. Set a date that will permit adequate and uninterrupted time for discussion. Inform the employee well in advance and suggest that they prepare themselves with questions on topics that they wish to have discussed. Give careful objective thought to individuals' performance for the period being evaluated, not previous performance or future predictions. So they should be evaluating them on the year in question. So in 2023, they would be evaluating the employee's 2022 performance. Oh boy, where was I?
I think it's encourage open.
Encourage
you.
open.
Encourage open and free discussion in a respectful manner during the conference to maximize beneficial results of the performance review. Newly added is an employee self-assessment section. And the reason we added this is because the platform that has been purchased for this policy has an employee self-assessment section. However, we're not going to require this because of certain statutory guidelines that affect the sheriff's office. So this allows it to be an optional item for them, so we don't interfere with any legalities for their office.
I have a question.
Yep.
Do you know what the legal issues are with the sheriff's department that prohibit?
So if an employee admits something, I would want to defer to sheriff because I don't want to
Okay.
misspeak to it, but
Okay.
it's something about it being a recorded. It could go toward them testifying in court
Oh,
and
okay.
being admissible in court or something along those lines, with it being an actual document in their file.
Okay.
Interesting. Okay.
A department head or employee may request that a self-assessment be completed in conjunction with the performance review process. Should a department head or an employee request this, the self-assessment shall be completed based upon the competencies included in the performance evaluation for the current evaluation period. So they are evaluating themselves on the same categories that the department is evaluating them on. Performance ratings. So the group of department heads decided on 5 standard competencies that every Trempealeau County employee would be evaluated on. Those are job knowledge, teamwork, professionalism, communication, and performance. Now, for the purpose of this policy not being a ton of pages, we did not include the definitions of those competencies in the policy, but we do have them defined in a separate document that would be provided to the department heads, which is included in your packets as well. Employees shall further be evaluated based upon 3 of the following competencies as determined by the department head on an annual basis. Competencies selected by the department head will pertain to all employees within the department. So we also recognize that people in the Human Services Department shouldn't be evaluated on the same categories as the people in the Highway Department. So how do we capture that? We added 5 more options. Department heads will choose 3 of those options to evaluate the rest of their staff on. Those include safety, use and care of government property, ethics/confidentiality, critical thinking, and customer service.
Ooh, I like those.
We spent most of our time defining these competencies and coming up with that.
No, I mean, I think they're really good.
Yeah. Employees in a supervisory position shall further be evaluated upon the following 3 competencies: directing and supervising, planning and organizing, and decision-making. Evaluation in the above competencies will be given as either acceptable or needs improvement. The evaluating supervisor will provide additional comments to explain why the employee was evaluated in the way they were evaluated. So in total, employees will be evaluated on 8 competencies, 5 standard, 3 optional, and then those that are in leadership positions would be evaluated on 11 competencies.
Nice work.
Very good.
Looks good.
Like it.
I'll make a motion, we go with it.
I'll second.
Okay, motion made and seconded to approve.
You have a?
Yeah, I know, I wasn't gonna call it.
Effective
Oh,
date.
okay.
Yeah. Any other discussion on an effective date, perhaps? When do we wanna?
So what I would propose is a January 1st
Yeah.
effective date. The tentative plan to roll this out would be at MLK Training Day. We've worked with NeoGov. They're going to provide a 30-minute training video for staff and supervisors to watch, introducing the platform that this will be housed within, and then the department heads and leadership teams would have additional training with the HR department as it flows.
Okay.
Nice, I like it.
Is that,
10 years in the making.
Yeah, the last time it was updated was
Coming.
2000.
It's all Deb
10.
Sukala's fault. Because we didn't remember? We didn't like.
From last year, you mean?
No, from like years ago when we were doing your evaluation, we decided it was a terrible tool. And then it disappeared. We didn't use it anymore.
And that was only used voluntarily, that wasn't even used all the time.
So there was no standard performance
No.
reviews before this?
No.
more or less, no.
Since Act 10 was put into place,
We-
to my knowledge, the county has not had a formal process.
So regular.
Yeah, and that was what the,
Services had a performance tool.
Right.
It wasn't the HR evaluation, but we did talk to our staff annually about performance.
Yeah, and I think supervisors generally talk with their staff, but the tool we had before just, rank 1 to 5 or 1 to,
it was,
Reminds me a
yeah.
lot of performance reviews.
it wasn't good.
And I like that there's a self-assessment so you can kind of compare notes and get
Yeah.
constructive feedback. So
Yep,
And I hope, even though it's not mandatory, I hope staff take the time to do the self-assessment because it's, it's really important to look at,
Yep.
to be,
I do want to note that each department head that decided to participate really valued the self-assessment. It just came down to legal reasons of why it's not required. I do anticipate, at least for the department heads that participated, will require that of their
use it.
staff.
I think it's really important.
yeah.
I would
Well,
agree.
I think that it's been a long time coming. The committee, it was over a year ago, I think, when we knew we wanted to do this. It's just has
Yeah.
taken time to get to this point, so,
we've had COVID.
yeah, so.
COVID.
It's, anyway, so any other discussion on this? Otherwise, we have a motion and a timeline of January 1st. Any other discussion? All in favor, say aye.
I,
Aye.
Opposed? Motion carried. We have performance reviews. Next, we have Human Sources Supervisor on-call rate up for discussion, possible action. Deb?
where is this? Okay. Oh, we just talked about this Monday where Ron sat next to me. Wow. Good God.
Did you send that out in the mail?
Yes, so they have the policy that you drafted as well as the spreadsheet that you gave me.
So, some of you've heard this, because you're also on the Human Services Board. So we have an on-call system that's been around for a long time because we have to take calls after hours for, children, families, cases for kids that are, in danger of abuse or neglect, for individuals with having mental health or substance abuse crises. Sorry.
So, again, for children, families, for kids that are abused and neglect, for juvenile justice, for youth that may have been involved in some type of law-breaking situation, for people with substance abuse or mental health issues, if they need to have emergency crisis to be detained to protect themselves or others, and then for adult protection, for vulnerable adults that might need to be taken into protection or at least have their situation reviewed for protection. So we've been doing that for years. And so with the on-call system that we have, looks like this here sheet that you have. For many years, we just had the staff on-call rate, and then a few years ago, we added the supervisor on-call rate. Most staff end up calling their supervisor, or in many cases, have to call their supervisor for certain actions. Staff can't just place a kid in auto-home care overnight without talking to their supervisor. And oftentimes, these are complicated cases, and they need to check in with their supervisor. So the supervisor rate is half of what the staff rate is. And we felt that that was fair because they get about half as many calls. And so this has been working well. We have supervisors for children and families, 2 supervisors that take turns for coverage. And then for adult protection and behavioral health, we've had 2 staff that have shared that. One right now is doing the most of it, but that's the agreement between the supervisors. So the situation we've run into is because of this labor market, we're having a hard time hiring staff. And so for staff that should have a regular on-call rotation to be taking those calls, there's nobody. So supervisors have to step in on occasion and do those. And what we'd like to do is we'd like to be able to clarify in this policy so that there's no confusion in HR or when Stacy's doing payroll, that if Tia, for example, is claiming the staff on-call rate, it's because she's filling in for a staff on-call rotation, and she should get that full rate. The other reason we're doing that is because we've had, in the last year, 3 lead staff move into supervisors. There isn't a lot of, there's kind of some wage compression between those two. So again, we don't want this to make that further exasperated. So we want to be able to give supervisors, when they're doing on-call staff rotations, the on-call staff rate instead of the supervisor rate. I probably made a simple thing sound more complicated, sorry.
To further support Deb's argument, we do have 4 within the last month social worker openings, and so there is a higher need for her supervisory staff to be available, and that would be until those positions are filled.
We've had some children families positions that have been open since the summer. We're just not getting the applicants or getting qualified applicants. So it's just a labor, we haven't had that problem before. It's just a labor market that's crazy.
Okay.
I'd make a motion to approve this.
So the motion is to approve the,
To my knowledge, the supervisors are claiming the supervisor rate because they didn't know if they could get the staff rate, I think.
No,
Okay. Okay.
it's already being done on
so it is already being done in the method that is desired to make it a formal policy. Okay.
To me, if they're doing the same job as the staff, they should be getting that pay.
Yeah.
It's pretty straightforward.
Yeah, I don't know why we wouldn't. So,
It's not a lot of pay for the massive amount of work
Nope.
you might have to do between 8 PM and 2 AM.
Well, and it's just a new issue, so that you didn't have to address this before. so-
Right.
yeah. No, I think it's reasonable if they're covering this kind of job that we would. Effective, when's next?
We might do,
It's
Backdating
been
it,
at least 2 payrolls, I know, I didn't look back.
we just effective immediately work okay then for you?
Yeah,
Okay.
that's, it's not for me to judge the auditors.
Well, or we can backdate it if that makes it better for the auditors.
do you know the date of 2 payrolls ago?
That makes more.
Tia's the only one been doing it, and she started as a supervisor in September. So I don't know
Probably when
when
she
she would have,
started.
I don't know which shift she's covered and done that. I don't know that off the top of my head.
So effective date
Effective immediately.
immediately?
I'll
Okay,
pull these minutes to reflect that.
Okay.
was discussed.
okay, so we have a motion to do it effective immediately. Do we have a second? Any-
Yep.
Heather for a second?
Heather?
Oh, yes.
Yes, yeah, okay.
Sorry.
All in favor, say aye.
Aye.
Opposed? Same sign? All right, motion carried. Next,
Thanks, Deb.
next we have Employee Benefit Corporation monthly administration fee increase. For
Yikes.
discussion, possible action.
Yes.
It's a long sentence.
So I will be honest, I don't know that we are at a point of needing an action item. I just wanted this committee to be aware of it, given that this will be my last meeting here. I just want you to be aware that this is coming. So our office, I did attach what our office received from Employee Benefit Corporation, so 2 items with this. I looked back the last 3-4 years, and we have not been charged a renewal fee from Employee Benefit Corporation within the last 4 years. I received the November invoice, as well as this document that I put in your packets, that is stating for the 2023 plan year, we are expected to pay a $450 renewal fee. This is on my November 2022 invoice that I need to process today. I am working with the clerk's office to determine if that's within the 2022 budget for me to even be able to pay right now. So I don't know if that means a resolution or not, because this is one of those plans where it's an approximation when the budget is put together. It's all dependent on how many people are in the plan on what we are charged. So I'm working with the clerk's office. I will sort out the November bill.
So this is for 2023,
It's a renewal for 2023, but it's
Okay.
on my November invoice.
but it's the first time we've ever.
Correct,
Got
so I
it.
don't
Do you
have
know
a past
why they
practice.
decided to give us this fee?
I only received this in the
What,
mail.
what's in the letter, okay, and I saw
Yeah.
that, so, okay.
So I'm not entirely sure. One thing, though, that I do want to point out is that I don't know if it was at the beginning of 2022 or the beginning of 2021, but when Employee Navigator was established, we have a file feed that goes right to EBC, so we don't do any manual enters into EBC anymore. Because of that fee they wanted to charge us, we have canceled with Employee Navigator, so now we are going back to manually entering all of the enrollments into Employee Benefit Corporation for the FSA. Just to clarify, we're talking about the flex spending account.
Right, okay.
So I don't know if this is because we're going to need employer access again on their website or not, but I could certainly try to
Okay,
get some
Find
clarifying
out, yeah.
information. Because what I anticipate doing is paying my November invoice without that fee and ask them for clarification, then it would show up on my December invoice, I would imagine. What I don't want to happen, though, is a lapse in coverage. That's what I'm concerned about.
Okay.
So
Okay.
in addition to that renewal fee, they also notified us that we have been charged $4.50 per employee enrolled in the plan on a monthly basis. That is a monthly administration fee. That fee is going up to $4.71 in 2023. So I did some math just to give you an example.
$4.70, why couldn't they just say $4.70?
You're telling me. To compare with my November 2022 invoice, because that's the one I'm processing right now, that total on the invoice for the number of participants we have right now is $913.50. So that'd be like what we pay on a month per head, not per head, excuse me, total for the heads. Versus if we were charged at that 471 rate, it would have been $956.13. So that's an increase of approximately $42.63 per month. And so annually increase of $511.56 approximately.
And that's for 2020, starting in
2023.
Okay,
But I used November's numbers just to give you an idea.
okay.
Especially because it's impossible to predict how many participants we'll have, so.
Sure.
Right now, we have several openings, so I do feel that there will be plenty in the rest of the 2022 fund to pay this renewal fee, but, yeah. So I don't know that you need to take a motion. I just wanted this committee to be aware that it may result in a resolution to the budget.
Okay.
So that fee goes up and down every month, depending on how many employees.
The total goes up and
Yeah,
down, but
yeah,
per employee,
yeah.
it's $4.50 currently, going to $4.71.
Are a majority of employees in the flex spending?
So they are automatically enrolled in the
Okay, they
flex
are,
spending
okay.
if they are on the health insurance.
Oh, okay, okay.
Majority
If
of
they're not, okay, all right. I get
employees
it.
are on the health
All right.
insurance.
Okay. Okay. Any other
Interesting.
discussion on that? Otherwise, we'll move on to employee trainings funded by the county for discussion.
So during another oversight committee meeting, a discussion was had relative to an employee that recently resigned, having participated in some county-funded training. So I was asked by a board member to bring it to personal bargaining to discuss if it would be appropriate to consider when the county is paying for an employee to attend training, if that would be appropriate for that employee then to sign a contractual agreement stating that they would have a length of service with the county, and if they don't complete that length of service requirement, then they would be required to repay the county for those funds. Couple things to note here that I just want you to consider while you're discussing this is that training is not currently administered by our office unless it's something to do with like leadership or we're asked to participate in that. department-specific training is managed on a department level. So I don't have real numbers. I would have to do some research on how applicable, how much money is going into training, what types of training, those types of things.
The frequency that this would happen, or
Right, so I don't have a whole lot of raw data to discuss, but something to talk about.
Can we legally do that, Mr. Niemeyer? Have them sign a contract that if you go to training, you need to stay here for a year?
You can certainly enact a policy that would cover this particular topic, just what that would look like. It might be one of those things where if we're trying to attract people and we're having difficulty doing so, this might be one of those things that might persuade someone to maybe take a different job versus this one if they know that they might have to pay something back. Just food for thought. But we can enact a policy and put the parameters on it if we want to.
I will say it's very common practice in the private industry. I don't know, what the trainings look like and the costs
So
associated.
did this person like go to training in October and then resign in November, or?
Yeah.
Oh, I just pulled those
More or less.
months out of my head.
That's where I was like, it just threw up some red flags to me, where I was like, if we're going to pay for trainings, then I felt like there should be some kind of skin in the game, not just get trained here and then go somewhere else.
Is there, is that training that can be transported to their new job?
So in that particular situation, that was a training that actually did not have a cost associated with it. The budgetary line item was associated with that individual's pay because he was on the clock when he went to this training. It was also a requirement for his position to be
Okay,
certified
but there was no
there.
money.
There was not, and
No. It looked like a $900 some amount, but I guess, so that one, I guess, evened out. But I just, looking future, it's because it seems like we've had a lot of people use this as a training grounds and move on.
Right.
I was just concerned that, that we're wasting taxpayers' money on training these people, and then they leave somewhere else, and then we get new people that we have to train, and how much money are we pumping into training people to leave? That was my big concern.
Well, so, a lot of training is not all tax dollars. It's covered through state,
Which is still tax dollars.
Right, right. But I hate to think about putting a policy into effect. For example, if we just sent you to a training and then you found out, oh, next month I have to move to Massachusetts, where it just came out of the blue. It doesn't, we can't control everybody's lives.
It's not always intentional.
So just background in healthcare, the healthcare center trains people and then requires them to stay there for a certain amount of time. They'll pay for their schooling or training. When I worked somewhere else, they offered to pay for my training. I chose not to because I knew I didn't want to stay there. So I paid for my own training on certain things. So it is something that happens a lot outside of the government realm. And I just don't want to see, we already have enough budgetary issues. I'd like to see us being really smart with how we're doing it and holding people accountable to actually use their training here where we paid for it. So if it's, I don't know how we would write the policy if it's a stipulation that they have to have it for their job and it could be covered by a grant, but ultimately, whether it's federal, state, or local, we're still paying for it as taxpayers. So.
I know that the healthcare center doesn't, sometimes people forego their commitment that they've had.
And I don't know.
And
if
I don't
they
know
have
how
to pay
that
it
gets all
back.
sorted out, but.
Like I know for another job, if I had decided to accept their offer, they told me that if I did decide to leave early, there was a contract I would have been signing where I would have had to pay back the balance. So I don't know if that's what the healthcare center does.
They have that contract. I know of an individual that negotiated some different agreements, but it was agreed to on the part of the healthcare center that they didn't have to completely pay.
So there can be a proration too. It doesn't have to be an all or nothing. It can be, if something did come up where you have to leave or life happens, and it happens in the private sector too, then they can work out like a monthly payment to pay their commitment back. Because it is benefiting them where they move.
Maybe.
So,
It could.
it could, yeah.
So that is one thing. In my former position, we did these types of agreements, but things that we took into consideration, we didn't have a specific policy in place because each case, it was reviewed on a case-by-case basis. So what we considered, though, was the amount of money that we spent on the training. So if it was above a certain threshold, then we would start to look at this. How specialized is the training? In terms of, you know, if it's a course that's going to go towards a CEU credit, outside of a like relative to a certification they may hold that could benefit them at another position, then again, we would continue forward with that. And then we always reviewed length of service, so it was never usually the same amount. So maybe they had to stay for a year, maybe they had to stay for 6 months, maybe they had to stay for 5 years. It all depends on how much the company spent. That's how it was practiced in my former position.
Didn't we have something in the highway department about supporting and paying for CDL licenses, and then if they got it while they were working for us, and then they left to go to the private sector? It feels like we discussed that once here.
I feel like we did.
They either have it
Or is there
Like it was
some
a
other
job
kind
requirement?
of training that,
There was discussion, because I think the issue was, you take some of the shop guys or something, that they may get hired because they have the shop skills that we need, but eventually we want them to be able to, if they need to fill in or or test drive a truck or something, you know, they're legal to go and do those things. So I think that's where it comes in.
yeah, I just have a
Something
vague
along those
memory.
lines,
Right.
and I don't know the details, I don't think.
Well, I think it's worth
either.
a discussion, you know, on policy development, and I think department heads might want to have some say in this, and, yes?
So what kind of trainings are we talking about here? Because we send our staff to a lot of training. For social workers, they have to already have their degree before they come here. We don't pay for degree courses, but they do take courses or take classes, workshops, whatever, that count towards their CEUs, continuing education hours that they have to have. They have to have so many every 2 years to retain their certification. We don't mind paying for that as long as the supervisor approves it, as long as it benefits the job, because these are only like a day or a couple day
Right.
type sessions. So what kind of training are we talking about? Because I want to be clear on that, because it would be hard for us to,
Develop a policy.
because if somebody goes to a training today on trauma-informed care, they can use it tomorrow, and so if I only get another month or 2 out of it, it might have been worth it to us. So I want to be clear what kind of training you're talking about.
I think there's gotta be a dollar amount threshold, like you kinda mentioned that, where it's worth it to mess with it.
Yeah.
Because like you said, even a few days may be more beneficial to the county for some trainings.
Yeah.
And others, you take a leadership training or something like that, where maybe we spend $1,000, or I don't even know for sure, but you know, some of those kinda escalate.
And for economic support staff, they have to take a few months of training just to be able to do their job. And the only cost to us is their time.
And that's the same with social workers. Before they can even go out on a case, they have to do all of that training that's online.
Yeah, they have to do the
You can't
PDS training
even
and stuff, yeah.
leave the office on your own until you've done that and passed all the exams on that.
But again, those courses don't cost us anything
Right,
other than the
right,
staff's time.
just their time.
Sure. I know this is private compared to government. We were given a certain allowance per year to get our CEUs, and if it didn't cover it, we still had to do that to keep our license, like for myself as a PT assistant or, you know, our PTs. So it was just something I want to look at. Yes, I understand fully that CEUs are required to keep your license in many careers.
But if you don't
I
have
guess-
certification, you can't work.
Exactly.
If you're a social
Yep.
worker, if
Yep.
you fail to get.
Oh, I know. Same as in mine. If I did
Yeah,
not
so
get
Deb would
my-
have staff
Yeah.
that could not work anymore.
Right. So, so that our contract was written, they gave us a certain allowance, but we still, if we wanted to keep our job, we still had to fulfill the balance of it, or we would lose our license and be unable to work as well. So I get that completely.
Which is kind of a fair way to do it, though, because then it is on you, because
Yep.
then both
They
are
give you a
invested
certain
in your
amount, and then you
certification.
still have some skin in the game because
Right.
you know that you want to keep that career, and not have to retake your license exams.
Start over, yeah.
Which
Is not
in
fun.
social work is not fun.
I don't think in
in
anything is
many
fun.
careers, you don't want
Yeah.
to take it more
No.
than once.
No.
So I guess my concern was that it felt like we were having a lot of turnover, and so I don't know how to, it's probably a can of worms. I just don't want to see people here for a month, they get their training, and then they can move on to another county, and yep, I've already got this training, so they're a more qualified candidate for that job. So I don't know.
I think it's a longer discussion, and it varies. I mean, there's training required in ELU, the health
Lot of
department,
different-
everybody. It would be, a
I
can of
completely
worms is a
understand
good
it.
example for what
Yeah.
you've opened over there.
Yeah.
Well, I think it may be worthwhile just to look and see maybe what other counties or other private employers do, just to get an idea as to where they're at and see what may or may not work for Trempealeau County. That would be a suggestion.
Okay.
I would also suggest that my experience has been, I'm old, I've been a lot of places, training is also a retention tool. So again, how we use that, we don't want to save ourselves a nickel to lose a dollar. So I just want, again, there's lots of factors. I just want that one to be considered.
Good point,
There
too.
was a time when we were paying, and I know it was happening in Trempealeau County, we were paying the renewal fee for certification, and that was statewide. The state paid for my licensure renewal because they wanted to keep us.
Yeah.
Not that it's a massive amount of money, but,
So,
that was a thing that kept people in their place, and knowing that they were valued, that the county and the state was gonna support them in their endeavor. I had no turnover until people retired.
so, I think this is something that we probably need to flesh out a little bit more.
Yeah.
And,
I think Rick had a good suggestion
Yep.
as far as seeing what other places are doing. Just, it is a tough job market, so I get giving those incentives. Because it's a tough job market, we're also facing financial issues all around.
It is, I was just at the Western Dairyland meeting, Board of Directors meeting, and they're struggling too to get, it
It's
is.
a different job
This
market now than
world-
when I was
no.
working in the private sector.
This world of service, of social work and working in daycare, I mean, we just decided to give people bonuses because it is desperate. People are really.
Now you're pulling teeth to get people to work. Back when I was in more of that sector,
couldn't get,
if you didn't do it well, they'd find somebody else to fill your
Right.
spot. So it is a different job market. I
Yeah.
get that too.
Nobody
think-
wants to be a social worker, nurse, or daycare provider anymore.
here's how I think we need to progress with this. I think it comes back on the agenda, likely after Krista's back. At this point,
Like
there's
February.
February probably-ish, because I don't think at this point we have the manpower to
Right.
dig into this. So,
Well, Carla's got all kinds of time on her hands, you know.
Who does?
Kayla.
Kayla's got all kinds of time on her
I think you said Carla at first.
He calls me Carla, I remember. Yesterday, he almost ran me over in my office.
You kind of remind me of a woman I know named Carla now that I'm going to probably start
And
calling
then
you
it-
Carla.
do we
I
just,
won't call you Carla.
do we just leave some kind
I
of
know it's
note
Kayla, but
asking
I do the same thing.
if they can
Put it
look
on
at
my
what
phone.
other counties are doing?
Gabe.
I think that would be
I
the
can
next
always
step.
call him.
And
No, it's Gabe.
Making some notes here for that.
Sure, I
Long.
think that sounds good. So,
So make a note to review with Krista and come back on a future agenda.
future agenda item.
I just want to clarify too, the direction you're giving our office is to reach out to other counties to see if this is something they're currently practicing.
Other counties.
Yeah, and you don't really
more or
deal
less.
with training. That's a department by department, because they
Correct,
have a training
because-
But
budget.
it's whether or
Typically
not
it's-
there is a policy in these other
Right,
counties.
right.
Right.
And how it's
If
structured.
they set a
if there
dollar
is
amount or
one.
what they did, yeah.
Yeah.
Well, Deb, you budget for training, you have a dollar amount, and you can't go over it.
At a minimum, 1.5% of staff wages to put in training, because
Okay.
you know how valuable that is in our.
Right.
Okay. Well, let's move forward on with that issue and dig into it in the future. For today, we'll move on to item number 9, memorandum of understanding for human resource generalists for discussion, possible action.
So this one, I know Kayla wanted me to take it just because it involves her. So I think everybody's aware that after Kayla leaves, starting on December 5th, there has been some discussion about her still providing some remote services for HR. And so this agreement was basically put together based on what kind of both sides' expectations would be. And so it was just here for discussion to decide if this is agreeable.
I'm just refusing to accept the fact that she's leaving, so.
Did you get a chance to talk to Krista? You had said you wanted to.
I did. So Krista and I spoke, and we discussed an appropriate number of hours, which would be no more than 20 hours per week, at a specific pay rate, which is comparable to what I was hired at. In fact, it would be it would be less because of the county not paying for benefits. Yep. And essentially, it would be in place until her scheduled return date, January 11th, so that I can continue to be a resource for Lisa, as there are many tasks that Lisa will be taking on that she is unfamiliar with, so that I can continue training her, as well as assist Rick with processing. So again, that health insurance bill, it takes me 4 hours to do it, and I've been doing it since June. It would take Rick an entire day to sort through those types of things. So those are the types of remote things that I can do remotely to assist the department on a part-time basis.
Any discussion from the committee?
I make
think
a
it's a
motion.
good
Do we need a
option.
motion to approve this? Because I'm
we do.
making it right now.
Okay,
In a
motion.
second.
Motion made and
You and I are
seconded.
like on the same wavelength.
Well, we
today.
were in this whole meeting together already. I think we had already kind of decided we all liked the idea.
Yeah.
Uh-huh, yeah.
It was
It makes
it
your
felt-
idea.
Felt like it was a win-win. Well, Kellen actually kind of brought it up first.
Yeah.
Well, I mean, it's a way we can work through and bridge this, and I'm
Yeah.
glad that it looks like it
So
could
that
work.
Lisa doesn't go
We need
crying out screaming, not crying.
keep the department moving forward as best we can.
Yeah.
So we will. So we have a motion made and seconded. Any other discussion?
Do we need to put the dollar amounts in there?
They are in the contract.
In-
Motion,
oh.
motion being to move forward with the contract.
Yep, that's what my motion was.
As it has been outlined.
Yep.
Any other discussion? Hearing none. All in favor, say aye.
Aye.
Opposed, same sign. Ron, are you still with us?
I just said aye.
Oh, you blended right in, and normally there's a delay, so I didn't catch you. Okay.
I don't think the phone's as delayed as.
There's a very little break in the action.
You'll have that with this group.
I know, and he was really talkative on Monday.
Okay. So with that item is
Yay.
moved forward. And next we have our Human Resources Department update.
So since the October meeting, we have filled 11 full-time positions for a total of 53 full-time positions so far in 2022. I will just say to this group as well, we anticipate having 5 more positions filled before my last day.
Wow.
Awesome.
That's really good.
We have 8 limited term employees hired and 5 part-time fill-in employees hired so far in 2022. I don't have any events to report out as we are short-staffed in our office, so there's not a whole lot of events going on. It's more managing the day-to-day tasks. But I do want to remind this committee that the MLK Training Day will be hosted January 16th this year, and it will be virtual, given the circumstances in our department as well as the wishes of the staff.
And that worked really well last year, I think.
Yeah, and we've got the schedule pretty much well wrapped up. We actually did not have to pay for any speakers to come.
Oh, good.
We were able to utilize our resources and our vendors, and that is included in the fees we are already paying those types
Okay,
of vendors.
awesome.
The only thing that is outstanding with that schedule so far is if the sheriff's office would like to present on something. I know that they're discussing that in their office, but I've already got some time set aside for them. And the end of the day would look like NeoGov training for not only our Perform module that we discussed already today, but also the Learn module, which is the new training matrix, will be rolled out. And then we'd give them the rest of the afternoon to kind of familiarize themselves with those accounts and get maybe caught up with some of those outstanding trainings that have been put on hold up till that point. So that's the only event I really have.
Okay.
Okay.
All right. Well, our next item is a closed session. So
Move we go into closed session per Wisconsin statute 19.85, parentheses 1, parentheses C, to update the committee and consider employment, promotion, compensation, or performance evaluation data regarding county personnel.
Nutter, yes.
Oh,
Oh,
need a second.
Oh,
I'm sorry, second.
yes. Okay. All right, now we call roll. Nutter?
Nutter, yes.
Nelson, yes.
Fritz,
Frisch?
yes.
Austin, yes.
Johnson?
Nelson, yes.
Okay, we are
The
in.
computer has its own
closed
brain right
session.
now.